Hi, I'm Dr. Lisa Dawson from What the Cancer. Thanks for joining us today on either our website, whatthecancer.com, on Spotify, Apple Podcasts or YouTube. Make sure that you follow us on Instagram at What the Cancer and like us on our Facebook page. I hope you enjoyed today's episode and that we equip and empower you on your cancer journey.
Hi, welcome back to What the Cancer for episode 2. Today I'm going to talk to you about the role sleep plays in cancer. But first of all, I just want to tell you a bit about the website. We're really excited to be launching this next month. One of my frustrations as an oncologist and a lifestyle medicine advocate is that when people get cancer, they often head to the internet to get good information on what they can do to help themselves. But when you get on there, it's just so confusing. It's confusing even for me. There is so much hype, so much conspiracy theory, so much truth that isn't truth at all. I think it ends up making people more confused and more frightened than they were before. So the aim for the website is to bring you really the best information on what conventional medicine can do for you. And as I've said before, I really believe in conventional medicine and I have a deep respect for my profession. We have some amazing breakthroughs and drugs that are becoming available for treating cancer. Some of them are now even starting to cure stage 4 cancer, which was previously terminal. I also want to bring you really good content around what you can do to help yourself. In the last few years, there's been some really amazing studies showing us what effect lifestyle has in cancer. Lifestyle is things like diet, exercise, sleep, and stress. And there's a lot of things that you can do that are fairly simple but can have a really profound effect on your health. We are really bombarded, I think, on social media with the role that diet and exercise play in health. But foundational to good diet and good exercise and being stress-free is having really good sleep. I've had a really busy life and people often ask me how I'm able to manage to do as much as I can. I've always kind of wondered that myself as well, but as I've been learning more and more about the role of sleep, I realised that I've prioritised sleep all my life. Slowly over the years, I've worked out that sleep really gives me a good day and able to do all the things that I want to do, and I've worked out, without even really thinking about it, what affects my sleep. I know that if I'm stressed or if I've been watching stimulating TV, if I drink coffee or alcohol, that I'm not going to get a good night's sleep. So I'm going to be bringing you today some of the science behind why good sleep helps you stay well and healthy and why bad sleep causes cancer. And then I'll share with you some of the things that you can do to make sure that you get a good night's sleep. Next week, I'm going to be interviewing a doctor in Wellington who's a sleep expert. He's written a blog for me on what normal sleep is, and I'm going to be sharing that on my website. But next week we're going to be talking more about the role of cancer and sleep. And Andrew's recently been on a conference overseas where this has been a real hot topic of conversation. The World Health Organization has recently said that sleep deprivation is very probably a carcinogen. And in fact, some countries are now starting to pay compensation to shift workers who develop cancer, particularly breast cancer, as it's now so clearly plays a big role in cancer formation. Studies have shown that if you do shift work, you have a 40% higher risk of getting cancer. And I'll explain a little bit about why that is in a minute. So a good night's sleep is considered to be around 7 to 8 hours. A lot of people think they can have less sleep than that, but it's only a very small number of people who can manage on less than 7 hours sleep a night. To get 7 or 8 hours means that you get different phases of sleep which play a really important role in various different processes in the body. And if you shortchange yourself either by going to bed late or getting up early in the morning, then you're going to do various different types of damage. Because sleep fits in with our biological clock, you literally have a sleep pattern that matches that biological clock. So by going to bed late, you miss out on a type of sleep that happens in concordance with your biological clock. And if you're getting up very early, you're going to be missing out on a deep sleep that does different things. So you really need to be getting sleep at both ends of the spectrum to be healthy. While you're asleep, your brain does shrink slightly, and we know that by looking with functional MRI scans a little bit about what actually happens. So during the day, your brain is really active and busy, and it's making waste products that get excreted into the fluid around the brain. Unfortunately, because the brain is so busy, it's unable to get rid of those waste products. When you sleep and you need 7 to 8 hours, your brain shrinks slightly, and then you get a kind of express wash that gets rid of all those waste products, and they get washed away into the lymph system of the body. Your brain's then ready to go again the next day. We now know that those waste products or proteins that are in the lymph can then build up over time and are actually a precursor for things like Alzheimer's disease. We suspect that there will be, as we learn more about this, other diseases that occur because of those waste products building up. As I said, the advent of functional MRI has been able to help us learn a lot more about what happens in the brain when we sleep. And this has been lined up with what's happening in the body: hormonal changes, inflammation, healing processes, and effects on our immune system. As far as cancer goes, I think one of the most interesting things is the role the immune system plays. Your immune system is designed to help protect you against disease. You have various different parts of the immune system that are all working to remove infected, damaged, or precancerous cells. One of the types of cells is called a natural killer cell. It's literally like a soldier that's patrolling the body, looking for damaged cells and removing them before they become dangerous to you. When you sleep, your natural killer cells are really working at their peak, and we know that if you have less than 6 hours of sleep, the number of natural killer cells working decreases significantly. In fact, if you only have 4 hours of sleep a night, the number drops by about 70%. This literally makes you immune deficient and at risk of developing infections and cancer. Some of the other things that happen while you're asleep relate to inflammation. Inflammation is a process that happens in your body if you have some damage. For example, if you cut yourself, your body sends a whole lot of different messengers and proteins to that area to help you heal. Blood vessels become engorged with all the things that you need to heal, and that's why you get red around an area that you've hurt. But also, when you're stressed or sleep deprived, the same kind of process happens. Your body thinks that something's wrong and ramps up its inflammation. Inflammation is good in the short term. As I said, it helps you heal. But in the long term, it leads to lots of processes that aren't good for us. We know that inflammation is a precursor to lots of chronic disease, including type 2 diabetes, cardiovascular disease, and cancer. So when you're very stressed, you develop this inflammatory reaction that is sort of permanently in your body, and sleep deprivation causes a very similar effect. These inflammatory proteins, we now know, help drive cancer. They actually provide precancerous cells with the nutrition that they need to be able to grow, and also the chemical factors that drive growth. Once cancer has started to develop into a tumour, it needs blood vessels to develop in the cancer to develop the nutrition it needs. And inflammation helps the cancer develop those blood vessels. Let's take a minute as well to talk about the role of obesity in cancer. It's very clear now that obesity is linked with the development of cancer and is a risk factor. There's a number of reasons for that. Again, obesity causes inflammation that we talked about before, increases estrogen levels, which we know are a risk for female cancers and even male breast cancers, and is often associated with inactivity and poor diets, which further increase the risk of getting cancer. Sleep deprivation plays a really vital role in obesity. If you're sleep deprived, your appetite hormone ghrelin increases. Ghrelin literally tells you that you want to eat, even if you don't need those calories. People often, when they're sleep deprived, will find that they wake up hungry, And studies have shown that on average, if you're getting less than 6 hours of sleep a night, you'll eat 300 calories more than if you're getting 8 hours sleep a night. Over time, those 300 calories build up into excess pounds and lead you to be overweight or even obese. Also, sleep deprivation removes the desire to exercise, so you're more likely to be inactive during the day. This means not only are you eating more calories, but you're burning less calories as well. As you put on weight, you develop all those inflammatory reactions that are a precursor for developing cancer. If you get a good night's sleep, you're more likely to have higher levels of a hormone called leptin, and leptin tells you that you don't need to eat. You're more likely to eat less calories because you just feel generally full on less. We've talked a lot about the science of sleep. Let's just talk about what you can do to help get a good night's sleep. You have a biological clock that's running 24 hours a day, and there's hormones that are rising and falling during that time, which you need to line up your sleep to match. That way, when your biological clock is set and you're sleeping at the right time, you get the maximum benefit from sleep. This means that you need to have a routine. You need to go to bed when you feel sleepy. Don't miss that opportunity, and go to bed at the same time every night. If you can't get to sleep, it's best to get up, do some things, wait till you feel sleepy, and try going back to bed again. Get up at the same time every morning and open the curtains. The natural light helps set your biological clock and keep you on that good routine. What you eat and what you do during the day plays a big role as well. You need to move as much as possible during the day, and you need to get some exercise. This significantly helps you fall into the deeper patterns of sleep at night time. Try and get at least half an hour of aerobic exercise during the day, even if this is just a brisk walk. Any exercise is good. As far as what you eat, there are a few key things. Having a nice whole food diet helps keep your biological clock running well, and stops you from having insulin surges. Sugar is particularly detrimental to having good sleep, as is caffeine and alcohol. You really want to try and avoid having caffeine after midday. Caffeine has a really long half-life, so it takes about 6 hours to half the amount of caffeine in your body and 12 hours to quarter it. So if you're drinking a lot of coffee, even at 3 or 6 o'clock, 6 hours later, you're having the equivalent of half of that. So if you've had a couple of cups of espresso at about 3 o'clock, by 9 o'clock, it's the equivalent of having one espresso just before you go to sleep. Caffeine really disrupts deep sleep. This is the time that we talked about our immune system working at its peak. Even though you might feel like you're asleep, you may not be in those deep healing sleep patterns that you need to be. The other thing that disrupts deep sleep is alcohol. Ideally, as far as sleep and cancer goes, no alcohol is okay. But if you do want to drink, try and keep it to the occasional glass at a maximum of 2 or 3 times a week. Other things that you can do to help you sleep are keeping your room cool, avoiding looking at electronic devices for an hour before you go to bed, trying to keep the lights dim. If you do wake up in the night and need to go to the toilet, try having a red night light rather than a blue light, because this actually helps your brain stay in the sleep phase of your biological clock. Having a bath just before you go to bed, or a spa or a hot shower, helps your body temperature drop, and this also signals to your body that you need to go to sleep. Andrew's going to be talking to us more about sleep hygiene and the things that you can do to help. And so I look forward to bringing that along with the sleep science next week. So that's a little preview into the role that sleep plays in cancer. I'm really excited to catch up with Andrew when he gets back from his conference. Andrew is not just a clever doctor, but he's a great communicator, very funny and very interesting. And he's going to take us on a much deeper dive into the role that sleep plays in cancer and in your general health. As I said, he's already written a blog for me which will appear on the website as one of our resources. I suspect we'll have Andrew back on the podcasts frequently over the coming months and years to bring us an update on what we're learning about sleep. So over the coming weeks, we'll bring you some more about the role that diet, exercise and sleep play, and I'm hoping also to do some interviews with some other people. The website gets launched next month and you'll be able to download a free resource that I give to my patients. It's a brochure I've written which summarises the really important things in helping stay cancer-free. If you've had a diagnosis of cancer already and you've had curative surgery or treatment, you want to stay cancer-free. And these things in my brochure have all got good scientific or population study evidence that show that they can help. I'll be recording an audio of that brochure as well, so you can either listen to it as a podcast or you can download the brochure for free. Looking forward to catching up with you next week, and I hope you enjoy this episode.